Black women are facing a worsening maternity crisis in 2024. There were 50 maternal deaths per 100,000 live births for black women. That's higher than any other group. It speaks to show this viral video. They show what black women call discrimination from staff at the Dallas Regional Medical Center in Mesquite, Texas. She arrived to deliver her daughter. The emotional footage shows Carrie Jones doubled over in pain, barely able to sit in her wheelchair, as a white nurse continues intake questions rather than rushing her to the delivery room. Carrie's mother says the staff kept her daughter waiting more than half an hour, and she gave birth just 12 minutes after finally being admitted.
Is your What? How many times have you been pregnant?
3.
This is your 3rd pregnancy?
Yes!
You have 2 babies
It's
at home?
in my ass!
You have 2 babies at home? Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the black ones?
Everyone's a personality patient for you. Last name is Jones. She's G3P2. I'm not sure what her due date is.
Her due date
I
is
just said
the
it
10th.
was the 10th.
I think her due date is 10th.
She had 3 pregnancies, 2 babies at home. I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors. Everybody say how they treat people.
Jones and her newborn are undergoing extra medical tests after the trauma and stress they suffered during the delay. Dallas Regional Medical Center says it's reviewing what happened but can't share details due to privacy laws. Wow. Civil rights attorney Lee Merritt joins us right now. Lee, are you involved in this with the family, or what's your role here?
No, I'm not directly involved in the case. Like everyone else, I saw this happen in my community where, my kids were born in Dallas hospitals, and I was deeply disturbed. I've shared out about it. We've discovered other instances where things like this have happened, and we're seeing what we can do to protect black women, black mothers in the Dallas County area.
This woman is screaming in pain, and the damn nurse is on the phone. All of the data, you could get that data afterwards. In fact, you could say, get this woman into a room. Mom, I need to get information from you. But that was complete, utter indifference.
Yeah. And I'm concerned about her behavior, but I'm also concerned about the statements that the hospital itself has made since. We've all seen the video. We know what indifference looks like. We know that there's a black women's mortality crisis that are occurring in places like Texas. And this is the reason why. And so, yeah, we get that everyone gets due process, and this receptionist at the desk, she gets to explain her action. But we want to see direct and decisive response from the medical community that says this kind of thing will not be allowed and the black women are safe in Texas hospitals.
The mother, Cash, who goes by Cash with 2814 on TikTok, posted that video. And I don't understand how the hospital has not announced that nurse has been put on administrative leave.
Yeah. No, the hospital has acknowledged that they've seen the video that's been viewed now millions of times all over the world. They've acknowledged that the employee, that it took place in their facility, that is their employee. And they said, they gave us a blanket, generic statement that they care about everyone's well-being and safety, and that they want to give everyone the best experience. And obviously this family did not receive that. And so if they delay in making an assertive statement, taking an action against this receptionist, then they're going into the ratification area where they're ratifying the behavior of this actor and saying this is the kind of thing that black women should expect from the Dallas Regional Medical Center in Mesquite.
This was their statement to People magazine. We are committed to providing compassionate, high-quality care to every person who comes through our doors. And we are reviewing this situation, to understand what occurred. Due to patient privacy laws, we cannot share further details at this time, but our focus remains on ensuring that every patient receives the attentive, respectful care they deserve. First of all, patient privacy laws, her mama's already put this thing out publicly. And I guarantee you, the woman who with the baby, I'm sure she would say, oh, I will happily waive these privacy issues. Y'all need to talk publicly.
Yeah. And it's not only Ms. Jones' privacy that we're concerned about. They're concerned about the privacy of their own employee, and she's not entitled to HIPAA protections. That's not a concern that our community shares. We want to know what's going on with your employee, what actions your hospital is taking. Not any classified information from the victim. We've heard enough from her, and we've seen enough from her.
This is absolutely outlandish. Avis, your thoughts?
Is I've had natural childbirth twice, and I can tell you one thing: as soon as she found it, first of all, it was obvious this woman was in active labor. Number one. Number two, she knew that this was not her first child. Typically, subsequent children come faster than your first child, so she should have known that she could have dropped that child at any moment. I've heard parts of this video where she was specifically asking for the anesthesiologist. I chose not to do that, but that was my choice. If she wanted to have an epidural, the fact that this woman just sat there and allowed her to suffer ever since she got
30 minutes,
should have immediately
30 minutes.
pushed. Exactly. And who knows what could have gone wrong in those moments. She's not a doctor. She wasn't being checked out at the time that she was going through this active labor. Anything could have been happening. And this is one of the reasons why we're seeing the fact that Black women have a maternal mortality rate that's roughly 3 times that of white women in this nation. One of the reasons why is because our pain is not respected. Our pain is diminished. And somehow you have people like that who do not listen to mothers who are writhing in pain and doing what they can and should do as health professionals, not only to protect her health and well-being, but also to protect the health and well-being of that unborn child. That woman needs to be fired, period.
Absolutely. I'm looking here, I'm on the mom's page, and I'm just looking for her any latest here. But, I mean, I just, Ome Congo, this is absolutely wild. You have a comment or a question for Lee?
Well, I do. I have a question for Lee. Thank you so much for joining us tonight. I want to know if, when you look at the indifference of this woman towards the sister who was given birth, does it at all make you conjure up some of the cases of the unarmed shootings and things that you've represented where people have just kind of left us lying in the street, no medical attention, just the indifference? Because that was some of what was going through my mind.
You know what? That's exactly what it makes me think of. It's the systemic dehumanization of Blackness itself. And so the same medical workers who are neglecting this mom, they reflect the same kind of medical workers who had to deal with some of my victims after they were victims of police violence. And often we see the medical community make a choice to either side with the patients. And I've seen heroic medical workers say, I will not allow law enforcement to neglect and treat people this way. This is not the oath that I committed to, or, this is not how we do it in this field. And then we see people like this woman who adopt the culture of hook and sinker and reflect very much the culture that devalues Black life that we see often in American policing.
Mateo, I'm reading the mother's page, and she said the baby was crowning in the wheelchair, and there were 4 others sitting there talking about it and did nothing.
I mean, I watched the video. It was horrific. It's a case not just of carelessness. It's a case of discrimination. It potentially, I don't know the details, but as I watched it, it potentially violates a host of federal laws. It could violate EMTALA. It could violate the ADA that recognizes extreme pain as a disability. It certainly would violate Title VI of the Civil Rights Act. And I think that the question is not whether the hospital made a mistake or whether the individual. The question is whether they follow the law. That's what we need to focus on, and then there needs to be redress for that. That idea that the health and the well-being of Americans is valued less than that of white Americans has got to stop. This is systemic, and we know it's systemic because we look at the numbers. Black Americans with heart disease receive fewer interventions, they receive fewer stents, and fewer cardiac surgeries. They are routinely diagnosed later. This is data, this is statistics, and they're treated less aggressively. Black patients are 40% less likely to receive pain medication in emergency departments. Black patients face higher rates of preventable complications. The same complications that are routinely diagnosed by doctors and by nurses are less likely to be diagnosed if you have the wrong skin color. This is systemic. This is not that lady. That lady is representative of a system that absolutely needs to change.
Yeah, Lee, I guarantee you, ain't no white woman sitting there 30 minutes screaming in pain, and they're like, so how many kids do you have?
No.
You've been pregnant before? Who's your doctor? And then you call the doctor. Come on, man.
No human reaction. And despite how offensive it is, he was exactly right. It's a violation of the law. The law requires that anyone who comes in and presents with inactive labor gets immediately to a bed. You deal with the paperwork later because lives are at stake. Literally, life and death is at risk. And we claim in Texas to be a state that cares about children, about the birth of children, how important that is in the conservative community. Well, this is where it starts with Black women's, how Black women are treated in hospitals all over the state.
That woman, that nurse, whoever she was, she should not be in that position at all. She should be suspended. There's no reason in the world where she should be there. All right, Lee, thanks a lot.
Thank you.
Hello, I'm Isaac Hayes III, founder and CEO of Fanbase, and I'm here with a very important message. We are at a turning point in the Black community where we must have equity in the apps we use that scale to billions of dollars. But this time, we own the infrastructure, we own the culture, and we shape the future. And Fanbase is the future. Fanbase combines the free functionality of Instagram, TikTok, and YouTube into an all-in-one platform built for the evolution of social media and monetization. With over 1.4 million users, that's real proof that we are shifting the conversation of tech ownership and equity for creators. So right now, I want you to go to startengine.com/fanbase and invest today. The minimum to invest is $399. That gets you 60 shares of stock in Fanbase at $665 a share. This marks a turning point in Black ownership of social media. If we don't take this opportunity to own social media right now, we will always be customers to our own creations. And that can't go on. So once again, go to startengine.com/fanbase and invest today. We must own the platforms where our voices live, our stories matter, and where our culture drives the world. Thank you.